Now that it's Thursday morning out of the 8:30 news, that means it's time for What's Up, Doc, where we spend some time with the experts in healthcare at Mercy Health. This morning is no exception, although I did say to you off the air,
yes,
taking a look at the photo of the doctor who will be our guest here momentarily, it looks like a shot from a TV medical show.
Handsome.
This is the handsome, doctor that you see at the very beginning of the show that keeps you watching.
Yes, it is.
Now, if he hasn't hung up the phone, let's get over and spend some time with Dr. Panav Jha. Dr. Jha, good morning to you.
Good morning. Thank you for the kind words.
Yeah, I hope you don't mind us saying you're that Grey's Anatomy handsome kind of doctor right there that keeps people tuning in week after week. I'm sure you hear that all the time.
Well, it is, I guess, a benefit that my patients will come from me one way or another, right?
One way or another. Yeah. Tell us a little bit about you.
Yeah, so actually I've got a little bit of a different background than most of my colleagues in medicine. I was born in Canada. I grew up in the Cayman Islands, which is in the Caribbean.
Mm-hmm.
And then from there I ended up playing, tennis was my first dream. I ended up playing professional tennis. Then I played college tennis at the University of Kentucky. And then afterwards I played a little bit more. And then somewhere along the line, I kind of was like, I kind of want to do something different, and it ended up being medicine.
As a hilltopper, were you more proficient at singles or doubles?
I was actually better at singles, but honestly, doubles was more fun for me, especially in college.
Yeah. Just a sidebar, if we can geek out college tennis. College tennis, the format of that with a team with the 6 points for the singles and the one for the doubles, it is one of the best. If you ever get to go to a college tennis match, it's so much fun to sit there and watch that. It's not your usual stuffy, professional tennis match. There's some action going on in there. So it's exciting. Our first collegiate tennis player on the show.
This is the third healthcare pro that we've talked to from Mercy Health who's been a professional athlete.
Yeah, we had a football player, and soccer player too,
and now tennis.
Yes.
Yeah. So tennis was definitely what kind of led me into medicine. I'm super interested in sports medicine, so that was kind of my goal. And now I'm here at Mercy Health and basically using my platform now to try and get more patients for us.
That's outstanding. I love the fact, a Canadian in the Cayman Islands, so you're the only kid wearing flannel.
Yeah.
Where's the hockey rink, you guys? What?
I know, right?
We'll get to medicine here in a second, but how did you get to the Cayman Islands from Canada? Did your folks get moved down there?
Yeah, exactly. So my dad actually, he's also a physician, and he was working in the Cayman Islands at the time, but he was originally from Canada. So when my mom was pregnant with me and both my brother, he was like, you know what, we'll have them born in Canada and then move back to Cayman after.
Nice.
Not a bad place to live.
No, especially if you love stingrays.
Right.
I mean,
yeah.
It's got it all right there. All right, let's move over into the business you're in, which is, of course, family medicine. Give us a little bit of a general overview on what family medicine is as the way you perceive it.
So the way we would like to encourage our patients to understand it is that we want to be their doctor for almost everything. We can basically treat any patient from, newborn infants to pregnant women to the elderly. And we want to kind of have that care with them where we're able to see them, their next generation, their children, and that allows for a couple of things. It allows us to, understand the whole dynamic of the family and also treat the patient as a whole. I think that's the benefit of family medicine is that when you have one doctor who knows not just your mom's history, your kid's history, we're able to kind of use those as information and come to better diagnoses when it comes to problems you're having.
Yeah, I'm sure you see that. You see a problem that dad has or mom has, and you say, and you're able to give caution to the younger generation before anything gets too bad.
Yeah, no, exactly, and it's more so than just medicine too. Sometimes I think when parents or kids come in and they're worried about something, we kind of want to be that anchor that can let them know that everything's okay. Because a lot of times, the psychosocial problems can be almost just as bad as the real medical problems.
Yeah, no, absolutely, and mental health is in the forefront, rightfully so. Is that issues that you'll deal with as well?
Yeah, of course. Yeah, we definitely would be the first person that whenever a patient comes in and they're saying, I feel like I might have some sort of depression or some sort of anxiety. We're the ones that kind of get them understanding and screening and seeing if there's anything that needs to be worked up or anything further, if they need to go see a psychiatrist. But usually we try to be the front line in those diagnoses.
Dr. Jha, I'm seeing quite a bit of that over, I want to say, maybe the last 5-year span that when you go in, when I go in for my yearly physical or for whatever reason, part of what the getting ready before the doctor comes in is that little questionnaire on how your mental health has been and depression. This is a big focus, isn't it? Yeah, it's definitely something that I don't want to say that it's something that we're just trying to search for, but it's more so it's something that we're being aware of. Depression comes in different forms. It can be people who are totally happy and the kindest but their own personal life, they don't feel as satisfied. And then it could also be the type of people who, don't leave their room. So the questionnaires, those things, these screening, they allow us to really filter out and kind of determine there can be different ways that people show symptoms. So we really think that just these typical screenaires can kind of make it so that we're able to see every type of patient and diagnose every type of different depression or even anxiety. Tell us a little bit about the prenatal and postpartum care that you provide.
So that's the thing that we're really trying to focus on right now is that like I said, we're doctors who can kind of take care of everything. Most people don't know this, but actually family physicians can also deliver babies. So it'd be one of those interesting cases where we'd like to deliver your baby, see you during the prenatal care. Once you get pregnant, we could do your ultrasounds, we could do your weekly checkups. And then also, once you deliver the baby, we could also be your child's pediatrician. I think that's like a benefit that we have that most people cannot say they do, and we would love to, enjoy and have any of your listeners come and have their care with us.
Oh, so are you guys trying to replace the traditional services like an OBGYN would do, or do you work in conjunction with one of those?
Most of the times we work in conjunction, yeah. So the OBGYNs, they're obviously masters in crafts as well. They can do the surgeries, any gynecological things. If one of my patients ended up needing, say, C-section, I would send them right away to an OBGYN. But at the same time, sometimes if I see a patient in clinic and I've known her for years and she just so happens to end up getting pregnant, I could also see her as a OB patient. And then, it's a trust that we've built over the years that we can carry on going forward.
Yeah, looking at your photo here, you seem a youngish sort of guy. How many deliveries do we have to our credit thus far?
So far, I've been my first month here, I was on the NICU, which is a little bit more, the neonatal ICU. So a little bit more of the sick babies, but which, aren't always the best deliveries to be a part of. But no. I have been a part of 5 or 6 so far.
Cannot say enough good things about what the NICU department does.
I agree.
What the people who populate that department are capable of, and the care they offer. I have 2 kids. I wouldn't if it weren't for the NICU unit.
Totally agree.
I have an undying debt of gratitude to them, and that's got to be so highly rewarding too.
It is, and it's definitely. It's not just the baby is fine or it's getting better. It's just the amount of work they put in, day out. It feels really rewarding at the end of the day. And obviously a baby can't say thank you, but the gratitude you get from the parents is more than enough.
Dr. Jha, how long have you been with Mercy Health here?
So I've been here for about 3 months now. So I'm relatively new. Yeah.
Fantastic. Have you found? Because I was going to ask you, in the family medicine, what's your biggest generation gap of people that you've seen? You got to remember, my family doctor saw me, saw my parents, saw my grandparents, saw my great grandparents, saw my I mean, he had 5 generations of us under his belt. Do you have any of those wide spreads that you've met so far in your 3 months?
I have yet to build a generational gap like that. I actually just have right now. I've got a mom who I saw right after she delivered, and now I'm also going to be her child's pediatrician. So that's my first gap. Hopefully I can build another generation after that.
Are you stickers, or are you a sugar-free candy kind of pediatrician?
I would say stickers.
Stickers.
Yeah. Stickers. Yeah. I mean, you're the doctor, so you know more than me. But I will.
Oh, here it comes.
I will say that the safety pops with the little loop on the bottom. That was my doctor treat, and that was That stuck with me for a long, long time.
See,
so.
I'm older. It was a pack of smokes, and out the door you went. Yeah, just threw you a pack of smokes, and we'll catch you next time. Go easy on those. You don't want to stunt your growth as he's lighting his own. But, the time...
It would be a vape nowadays, right?
Yeah, it would be a vape nowadays. Plus, my kid's pediatrician, who was just a wonderful, wonderful man, had a little basketball net over a bowl that when he finished doing the ear exam, he would pop that thing off and across the room, and I never saw him miss.
That's awesome.
And my kids were fascinated by his skill of chucking the earpiece across the room through the basketball hoop into the little bowl that he had sitting on the desk.
Yeah, that's actually a good idea. I might steal that.
I think you should. I think it's a great idea, actually.
Yeah.
Dr. Jha, how do people make contact to make an appointment and get to know you?
Sure, yeah. They can contact the Mercy Health Alpine Family Clinic at any time. So really quickly, I can pull up the number for that. And at any time, they can ask for me, Dr. Jha, or any of my colleagues. The good thing about us is that we have appointments not necessarily 24/7, but any time of the day they can call. They'll always get in. They don't have to wait for any doctor. We've got many residents who are capable of treating them. And the number for that would be 815-971-3397.
Outstanding. And I imagine that you're the guy, who could spot tennis elbow from across the room.
That is definitely my key. That's definitely one of my defining features at this moment is whenever someone comes in with that tendonitis, I go either golfer elbow or tennis elbow right away.
You tell them to move over to that continental grip to lessen the stress on the elbow, right?
Exactly. Well, Continental's old school. We're going a little bit more semi-Western now.
Oh, very nice.
Yeah, way to go, Pappy.
Thanks.
Yeah. Been a while since you've been on the court, huh?
I guess.
Dr. Jha, thanks for carving time out of what we know is a busy day. We really enjoyed the discussion. I hope a lot of people may give you a call and become generational patients.
I appreciate that. Thanks so much for your guys' time.
Have a great rest of your day.